That with the Democrats' COVID-era subsidy that they wanted to extend, that would only impact 7% of Americans. The bill we just passed impacts 100% of Americans. Their version would impact 7% of Americans, and it would cost taxpayers $350 billion. That is not the way to reduce the cost of health care. The Democrats do not want a solution they just demonstrated, because they voted against this bill. They want an issue for the election. It is based on a false narrative. The Democrats broke America's health care system. When they gave us the ACA, the Unaffordable Care Act, 15 years ago, they promised that premiums would come down, that access would increase, and quality of health care would increase. None of that happened because it's a flawed system. Their response right now is to subsidize and continue to shovel taxpayer dollars onto a broken system. We say enough is enough. The Republican Party is the party that is bringing the ideas forward to fix this crisis and fix this problem for everyone. It is a serious problem. We took a big step tonight.
What we are witnessing in this moment, and I need you to understand the sheer magnitude of what we're looking at here, is nothing less than the crystallization of late-stage American conservatism as a politics of cruelty dressed in the threadbare costume of fiscal responsibility, because 20 million ACA enrollees will see their out-of-pocket premiums more than double on average when these enhanced subsidies expire January 1st, and Mike Johnson just stood in front of cameras with the audacity to tell us that Democrats broke healthcare 15 years ago, while he and his caucus engineer the largest mass dispossession of healthcare affordability in modern American history. And you need to feel the weight of this, because this isn't just policy minutia for the wonks to argue about in think tank seminars. This is material violence against working people wrapped up in rhetorical gymnastics so shameless that it would make Orwell weep. Johnson claims their bill impacts 100% of Americans, while the Democratic subsidy extension only helps 7%. And let me tell you about this particular species of mendacity, because what he's doing is comparing apples to hand grenades. He's taking a bill filled with association health plans and pharmacy benefit manager transparency requirements, these little boutique policy ideas that Republicans have been workshopping since their catastrophic failure to repeal the ACA in 2017, and he's pretending that these measures, which might marginally reduce costs for some subset of Americans over some theoretical timeline, will somehow compensate for the immediate brutal doubling of insurance premiums that will grow by 114%, from an average of $888 in 2025 to $1,904 in 2026. And this is the con, this is the grift laid bare in high definition. The number itself deserves our sustained attention, because Johnson keeps repeating this 7% figure like it's a talisman against scrutiny, but what he's really doing is isolating one particular provision of Democratic healthcare policy, and pretending that the entire universe of people who benefit from ACA subsidies is somehow this tiny sliver of undeserving recipients, and meanwhile the ACA funding bill expiring affects an estimated 22 million people who get their healthcare insurance through the Affordable Care Act marketplace. And you want to talk about 7% versus 100%. Well, let's talk about who actually benefits from Republican healthcare proposals, because their alternative, which they've been frantically workshopping in closed-door meetings, is to offer adults earning under 700% of the federal poverty level access to $1,000 per year in a tax-advantaged health savings account, if they're younger than 50, rising to $1,500 per year for those aged 50 to 64, paired with high-deductible plans where deductibles average around $7,000. So let me get this straight. You're going to give someone at most $1,500 a year to pay for a $7,000 deductible, and the money cannot be used to pay for healthcare premiums, which are the actual thing exploding in people's faces right now, and you're going to tell us with a straight face that this helps 100% of Americans, while subsidies that prevent premium costs from annihilating family budgets only help 7%. And this is what I mean when I talk about the conservative movement operating in a space beyond traditional political dishonesty. This is gaslighting at a civilizational scale. What makes this moment so clarifying, and I want you to really sit with this, is how perfectly it encapsulates the Republican Party's approach to social policy, writ large, because they've spent the last 15 years since the ACA passed, railing against Obamacare, calling it the Unaffordable Care Act, doing everything in their power to sabotage it, undermine it, litigate it out of existence, and now in December 2025, with roughly 20 million ACA enrollees facing financial catastrophe, they're celebrating their own act of legislative arson, as if it's some kind of policy achievement, and Johnson has the temerity to say that Democrats do not want a solution, they want an issue for the election, when his own caucus saw GOP moderates push hard to include an amendment extending ACA subsidies for at least a year, but were rebuffed by House leaders over concerns about the cost, and then 4 GOP moderates signed on to a Democratic discharge petition, providing enough votes to bring up a clean 3-year extension, which means there were Republicans in his own conference screaming at him that this is political malpractice, that their constituents are terrified about what's about to happen to their healthcare costs. And Johnson looked them in the eye and said, "No, we're going to let these subsidies expire because we need to make a point about fiscal discipline," except the Congressional Budget Office tells us that the GOP bill would increase the uninsured population by 100,000 and save the government $35.6 billion over 10 years, while 100,000 extending the enhanced subsidies would cost $350 billion over a decade. So yes, there is a cost here, but we need to have an honest conversation about what we're buying with that money and what we're destroying by refusing to spend it. Let's excavate the archaeology of this argument, because Johnson keeps returning to this claim that the ACA broke American healthcare, that Democrats gave us the Unaffordable Care Act 15 years ago, and none of their promises came true. And this is where we need historical memory, because what was American healthcare like before the ACA? Well, it was a system where insurance companies could deny you coverage for pre-existing conditions, where they could drop you when you got sick, where lifetime caps meant that a cancer diagnosis could bankrupt you, where young adults couldn't stay on their parents' insurance, where millions of Americans simply went without coverage because the individual market was a dystopian nightmare of junk plans and rescission and medical bankruptcy, and the ACA, for all its compromises, for all the ways it fell short of a true universal system, because it had to survive the gauntlet of conservative opposition and the structural impediments of the American political system, fundamentally transformed that landscape, and now we have enrollment in the marketplace more than doubled, from about 11 to over 24 million people, since the enhanced subsidies were introduced, and these subsidies reduced average premium payments by more than 50% for marketplace enrollees, and helped drive record enrollment. And what we're seeing is that when you make healthcare affordable, people sign up for it because they need it, because they're human beings living in bodies that require medical care. And Republicans look at this and see not a success story, but an obscenity, because the foundational conservative position is that the market should allocate healthcare, and if you can't afford it, well, that's a woke problem. Johnson's claim that their response right now is to subsidize and continue to shovel taxpayer dollars onto a broken system is so cynical, it takes your breath away, because what is their alternative? Well, as we've established, it's health savings accounts paired with catastrophic coverage and association health plans, which are essentially a way to let healthy people and businesses pool together to buy cheaper insurance that covers less, thereby fragmenting the risk pool and leaving sicker and older Americans to face even higher premiums. And this has been the Republican healthcare playbook for decades. Separate the healthy from the sick, the rich from the poor. Let the winners win, and tell the losers it's their own fault for not having better genetics or making better choices. Beefing up association health plans is one way Republicans have sought to provide cheaper but less comprehensive policies for healthier people. And we've been through this before during Trump's first term when they expanded these plans. And what happened was that people bought coverage thinking they were protected. And then when they actually got sick, they discovered that their plan didn't cover what they needed, and they were financially destroyed. And this is what Republicans call freedom, the freedom to buy garbage insurance and suffer the consequences. The discourse around the cost-sharing reduction payments that Johnson keeps touting as this big achievement in his bill deserves particular scrutiny, because here's what actually happened. Trump stopped paying insurers to provide the subsidies during his first term in an effort to weaken the Affordable Care Act, even though the law required insurers to provide those reductions, so insurers hiked the premiums of silver plans on the exchange, a practice known as silver loading, which actually increased the amount the federal government had to spend on premium subsidies. So Republicans sabotaged their own stated fiscal goal, and now they want credit for restoring something they deliberately broke. The cost-sharing subsidy funding could not go to any plans that cover abortion, which would effectively ban the procedure in Obamacare plans. So they're using this as a vehicle for forced birth ideology, because of course they are, because the cruelty is always the point, and every Republican policy initiative is secretly also about controlling women's bodies and restricting reproductive autonomy. What we're seeing play out in real time is the complete intellectual and moral bankruptcy of the Republican approach to healthcare and social policy, more broadly, and I know that sounds hyperbolic, but stay with me, because Speaker Mike Johnson said a subsidy extension only hides the true cost of the failed law, and this argument that subsidies hide the true cost is so revealing because what he's saying is that people need to feel the full weight of healthcare prices in order to make rational market decisions, except healthcare is not a normal market good. You can't comparison shop when you're having a heart attack. You can't negotiate when your child has leukemia. The entire premise of consumer-driven healthcare is that if we just make people pay more out of pocket, they'll be more judicious about their care. They'll shop around, they'll make cost-effective choices, and what actually happens is that people skip preventive care. They don't fill prescriptions, they ignore symptoms until they become emergencies, and then they end up in the ER, which is the most expensive possible site of care, and we all pay for it anyway, except now the person is sicker, and the intervention is more costly, and they might be saddled with medical debt that will follow them for years, and this is what Republicans consider a success. This is their vision of American healthcare working as intended. The timeline here matters enormously because Johnson gave this speech after House Republican leaders withstood a standoff with renegade members over expiring Affordable Care Act subsidies and passed a GOP healthcare bill with conservative priorities that wouldn't renew the aid. And this happened with only days before the subsidies expire on January 1st. The vote on a potential extension may not happen until the new year, which means that millions of Americans are signing up for coverage right now during open enrollment. Obamacare enrollees who want their coverage to begin on January 1st don't have the luxury of time, and the deadline to sign up for full-year coverage was Monday in most states, and the premium shoppers saw did not include the enhanced assistance, so people are making healthcare decisions in a state of chaos and uncertainty engineered by Republican intransigence, and they're going to get their bills in January and discover that the premiums have doubled, and some of them will drop coverage and some of them will struggle to pay, and all of them will know exactly who did this to them, which is why a vote to extend the ACA subsidies could help House Republicans who face tough re-election bids in 2026, and the GOP holds a razor-thin majority in the chamber, and Lawler said that not holding a vote on the subsidies would be political malpractice, because even some Republicans understand that this is electoral suicide. Let's talk about the politics of this for a moment, because it's essential to understanding why this is happening the way it's happening. House Speaker Mike Johnson took a dig at Obamacare at an event in Pennsylvania, telling a crowd there would be massive healthcare changes in America if Donald Trump wins the election back in October. Before the election, an attendee asked Johnson no Obamacare, and Johnson responded no Obamacare, rolling his eyes. Johnson said he was not in fact vowing to repeal the healthcare law, and was instead talking about broader reforms, and claimed the audio and transcript make clear that I offered no such promise to end Obamacare, and in fact acknowledged that the policy is deeply ingrained in our healthcare system. So we have Johnson before the election winking at the base, promising them that they're going to gut Obamacare, and then after the election claiming he never said any such thing, and now in December he's doing exactly what he promised, except he's using euphemisms like reform, and talking about costs, complexity, when what he's actually doing is making healthcare unaffordable for millions of people. And this is the pattern with conservative governance. They campaign on the subtext, they govern on the text, and then they pretend the consequences were unforeseeable. The framing that Democrats broke America's healthcare system 15 years ago, and Republicans are the party bringing ideas forward to fix the crisis, is such a complete inversion of reality that it deserves extended analysis, because what broke American healthcare was actually 50 years conservative opposition to universal coverage. It was the for-profit insurance industry that Republicans have protected and empowered at every turn. It was the pharmaceutical companies that they've allowed to charge whatever they want. It was the hospital systems that have consolidated into regional monopolies. It was the entire edifice of American medical capitalism that treats healthcare as a commodity to be sold to whoever can afford it, rather than a human right to be guaranteed to everyone. And the ACA was a compromise with that system. It used private insurance. It included Republican ideas like the individual mandate, which originated at the Heritage Foundation. It tried to make markets work better, rather than replacing them with single payer, and Republicans fought it anyway. They sued it, they tried to repeal it, they sabotaged it, and now they point to the problems they created and say, see, this proves government healthcare doesn't work, and we need to let the market solve it, which is the same market that gave us medical bankruptcy as a leading cause of personal financial ruin, and 45,000 people dying every year because they lack health insurance. When Johnson says the Republican Party is the party that is bringing ideas forward to fix this crisis and fix this problem for everyone, let's examine what those ideas actually are. Because we have the underlying GOP plan includes a measure to expand association health plans, which allow employers to band together to purchase coverage, and another provision would impose new transparency measures on pharmacy benefit managers aimed at lowering drug costs. And these are fine, I suppose, in the sense that they might help some people at the margins, but the House GOP bill would not do much to broadly lower healthcare costs, especially for those who buy coverage on the Affordable Care Act exchanges, according to experts, and this is kind of a greatest hits of Republican healthcare ideas of the last decade. As one health policy analyst put it, which is to say, These are the same recycled ideas that haven't worked before being presented as revolutionary change. And meanwhile, the thing that we know works, which is subsidizing premiums so that people can actually afford comprehensive coverage, is being eliminated in the name of fiscal responsibility. Except Urban Institute researchers have estimated that the end of enhanced tax credits will lead to 7.3 million people losing their ACA coverage in 2026, of whom 4.8 million would become uninsured, and the loss of the additional subsidies are projected to increase how much marketplace enrollees must pay by an average of 114%, and nearly 5 million people could lose health insurance coverage in 2026, and this doesn't even account for the ripple effects because the end of enhanced tax credits is estimated to lead to nearly 340,000 jobs lost across the U.S. in 2026, as healthcare spending contracts and economic activity slows. The sheer scale of human suffering embedded in these numbers should make us physically ill because we're not talking about abstractions, we're talking about real people with chronic conditions who will now have to choose between medication and rent. We're talking about families who will delay cancer screenings and let infections fester. We're talking about small business owners and gig workers, early retirees who will be forced to pay a price that many simply cannot afford, as one Republican congressman put it. And there's something particularly grotesque about the fact that a 59-year-old single widow earning $63,000, just above 400% of poverty level, would pay $5,355 for her Silver Marketplace plan in 2026 if Congress extends the enhanced premium tax credits. But if the credits expire, she could pay more than twice that $14,213 in premiums, almost 23% of her income, for the exact same health insurance policy. And Republicans look at that and say, well, she should have planned better. She should get a different job. She should have made different choices, when the only choice that matters is the choice they're making right now to let her drown. Johnson's rhetoric about Democrats wanting an issue for the election rather than wanting a solution is projection of such spectacular audacity that it almost commands respect for its shamelessness, because some Republicans have warned that ending ACA subsidies could cost their party the midterm elections, citing worried communications from their constituents, and we have reporting that centrists argue that Johnson has offered zero options for their party to deal with the looming healthcare disaster. Despite Republicans controlling all of Washington, Johnson and his leadership team had initially agreed to offer GOP centrists a floor vote on their proposal, but party leaders and GOP centrists failed to agree on the exact contours, and the deal collapsed. So Johnson is the one who refused to allow a vote on extending subsidies. Johnson is the one who rebuffed his own members when they begged for a solution. Johnson is the one engineering this crisis, and then he stands in front of cameras and accuses Democrats of playing politics when they're literally trying to prevent a healthcare catastrophe. Democrats hope to use the issue to mobilize voters in the 2026 midterm elections. If there is no outcome to prevent the cost increases, which yes, of course they do, because this is a genuinely outrageous thing that Republicans are doing, and voters should know about it, and should punish them for it, and that's how democracy is supposed to work. You do bad things to people, and they vote you out. The cost argument that Johnson keeps returning to, the claim that extending subsidies would cost taxpayers $350 billion, needs to be situated in the context of what this country actually spends money on, and what we consider worthy of public investment, because Republicans just passed a tax cut package that primarily benefited corporations and the wealthy. They've fought for decades to reduce marginal tax rates on high earners. They oppose closing loopholes that allow billionaires to pay lower effective tax rates than teachers and nurses. They're perfectly happy to spend trillions on defense and on subsidies for fossil fuel companies, and on all manner of corporate welfare. But when it comes to helping working families afford healthcare, suddenly we're concerned about fiscal discipline. Suddenly every dollar needs to be accounted for and justified and means-tested, and the cost is prohibitive, and we can't afford it. And this is the fundamental allocation question at the heart of politics. What do we value enough to spend money on, and what do we allow people to suffer without? And Republicans have answered that question clearly. They value capital. They value corporate profits. They value the prerogatives of private insurance companies, and they do not value the well-being of ordinary people, except as an instrumental means to other ends. There's a deeper ideological current here that we need to name explicitly, because this isn't just about healthcare policy. It's about the conservative worldview that understands society as a collection of atomized individuals engaged in market competition, where your outcomes are the result of your choices and your merit. And if you can't afford healthcare, that's because you didn't work hard enough, didn't plan well enough, didn't make yourself valuable enough to an employer who would provide benefits. And this is the logic of what political theorists call negative liberty, the freedom from interference, but not the freedom to actually do anything. Because freedom in the conservative imagination means nobody stops you from buying healthcare, but it doesn't mean you can actually afford to buy it. And this is why they love health savings accounts and high-deductible plans, because it puts the responsibility entirely on the individual. You're free to save money, you're free to shop around, you're free to make prudent choices, and if you get sick and can't afford your $7,000 deductible, well, that's the consequence of your freedom. And contrast this with the progressive understanding of positive liberty, the freedom to actually live a flourishing life, which requires collective provision of certain basic goods like healthcare and education and housing, because we understand that market outcomes are shaped by structures of power and privilege, and historical injustice, and sheer dumb luck, and that a civilized society pools risk and resources so that everyone can access what they need to survive, and this is the fundamental divide in American politics. Johnson says we say enough is enough. The Republican Party is the party bringing ideas forward to fix this crisis and fix this problem for everyone. And it's a serious problem, and we took a big step tonight to do that, except the GOP bill would increase the uninsured population by 100,000. So you didn't fix the problem, you made it worse. You took millions of people who have affordable coverage, and you made it unaffordable. And you're calling this a solution, and you're expecting us to applaud. And this is where we are. This is the state of conservative governance in America. In the year 2025, they engineer a crisis. They do enormous harm to vulnerable people. They lie about what they're doing and why, and then they demand credit for their own destruction. And what makes it so maddening is that this works on a not insignificant portion of the population, because the propaganda apparatus is so sophisticated, because Fox News and right-wing media will spend the next weeks and months telling people that actually it's the Democrats' fault, that premiums are going up because they created this dependency on subsidies in the first place, and if we just had a free market in healthcare, everything would be fine, and millions of people will believe it even as they're personally bankrupted by medical bills. What happens next matters enormously, because we're about to see a natural experiment in what happens when you strip away the supports that make healthcare accessible. The CBO projects that roughly 4 million people would lose marketplace coverage if the current subsidy structure ended, and KFF estimates that every state could see a rise in uninsured rates, with the largest increases expected in states that have not expanded Medicaid, and rural areas, and communities of color which already face barriers to accessing care, could be disproportionately affected, and rising uninsurance rates would also create additional financial pressure on hospitals, community clinics, and public health programs that serve as safety nets for those without coverage. So this isn't just about individuals losing coverage, it's about the entire infrastructure of care being destabilized, and we know from previous research that uninsurance kills people. Without affordable coverage options, people are more likely to delay or avoid medical care, leading to preventable hospitalizations and worse health outcomes. And some number of Americans are going to die because of this decision that Mike Johnson and House Republicans made, and we need to say that clearly and repeatedly, because these are the stakes. This is not a philosophical disagreement about the proper role of government. This is a question of whether people live or die, whether they suffer or receive care, whether they go bankrupt or maintain financial stability. The fact that 4 moderate House Republicans rebelled against House Speaker Mike Johnson, joining Democrats to force a vote on extending key Obamacare subsidies that are set to expire at the end of the year, using a discharge petition, tells you everything you need to know about where power lies in the Republicans' conference, because Johnson could have allowed this vote. He could have let his members vote their districts. He could have acknowledged political reality, but instead he tried to block it, and his own members had to use procedural warfare against him. The successful discharge petition was a direct rebuke of House Speaker Mike Johnson, who has refused to bring an extension up for a vote, and Johnson told reporters he has not lost control of the House, and we have the smallest majority in U.S. history, and these are not normal times, and there are processes and procedures in the House that are less frequently used when there are larger majorities, but when you have a razor-thin margin, all the procedures in the book people think are on the table, which is as close as a speaker can come to admitting that he's completely lost control of his conference, that his members don't trust him, that they're willing to humiliate him publicly because they're terrified of what's about to happen to their constituents. What we're witnessing is the culmination of 15 years of Republican opposition to the Affordable Care Act, 15 years of repeal votes and lawsuits and sabotage, and now finally they have the power to let it collapse, and they're doing it, and they're discovering that destroying something is much easier than building an alternative, and that their rhetoric about having better ideas was always empty, and that when you actually have to govern, you can't just say freedom and markets and personal responsibility. You have to actually help people, and they have no idea how to do that within their ideological constraints, because their ideology forbids the kind of collective action that healthcare requires, and so we get this absurd spectacle of Johnson claiming victory while millions of people face financial ruin, and the truly chilling thing is that this is the blueprint for everything else they want to do to Medicaid, to Medicare, to Social Security, to every part of the social safety net, because the goal has always been to dismantle the New Deal and the Great Society, to return us to a pre-Roosevelt understanding of government's role to restore what they see as proper market relationships, where capital is unencumbered, and labor is disciplined, and risk is individualized, and if you can't make it in that world, well, you weren't meant to make it. So when you hear Mike Johnson say that Democrats broke healthcare and Republicans are fixing it, I need you to understand that this is not a difference of opinion about policy details. This is a fundamental disagreement about what kind of society we want to live in, whether we believe we have obligations to each other, whether we think healthcare is a right or a privilege, whether we measure our civilization by how we treat the most vulnerable, or by how much freedom we give the most powerful. And right now in this moment, as these subsidies expire, as premiums double, as millions of people lose coverage, we are getting a very clear answer to those questions from the Republican Party, and it's an answer that should horrify anyone with a functional moral compass, because they're choosing cruelty, they're choosing deprivation, they're choosing to inflict suffering when they could prevent it, and they're doing it while claiming the mantle of compassion and responsibility and reform, and this is the work ahead for everyone who cares about justice, to name what's happening, to refuse the euphemisms, to connect the policies to the human consequences, to build the political power necessary to not just restore these subsidies, but to go beyond them, to actually create the kind of universal healthcare system that every other developed country has figured out. Because this isn't complicated, every other wealthy nation provides healthcare to all their citizens at lower cost with better outcomes, and we could do the same if we had the political will to overcome the opposition of the insurance industry and the pharmaceutical companies and the Republican Party that serves their interests, and that's the fight, that's the stakes, and what Mike Johnson just did makes that fight more urgent and more necessary than ever.